Thank you all for joining us for our SICSS-Howard Mathematica Lunchtime Talk with Dr. Randal Pinkett and Pete York from BCT Partners. During these chats while you chew, you'll meet interesting people or organizations that are doing cool and complementary work to what you're currently learning about in the Summer Institute at Howard. If you don't have your lunch yet, hit pause. For those of you with food and beverage in hand, let's get started.
Welcome. My name is Randal Pinkett. I'm joined by my colleague, Pete York. We are going to present a data science solution for predicting, planning, and evaluating social impact equitably. Pete and I are colleagues. Pete is our chief data scientist and a principal. I am a founder and managing partner at BCT Partners. And for the past several years, we've been developing and incubating a series of approaches and tools and solutions that are centered on equity. And they're undergirded by foundations of data science, of social science, of evaluation. And we're going to present to you both how we approach this work, as well as some of the tools that we've developed stemming from this work. So I'm going to offer my colleague, Pete, any opening remarks he'd like to share before we dive into the presentation. Pete?
Yeah, so pleasure to be with you all and to be here. I think you covered most of the bases. I think we're going to get to where we need to. I think the key that I would also just add to this is a lot of our motivation behind what we're about to talk about, this precision analytics, is to also really center learning, evaluation, and planning on the people, especially the people that are really on the front lines and those with the lived experiences. So take it away.
All right. So the approach that Pete has pioneered and we've developed at BCT further is called precision analytics. And you can think of precision analytics in the same way you think about precision medicine. That precision medicine endeavors to give you a single pill that's uniquely tailored to your DNA or your biology. Well, in the same vein, precision analytics seeks to understand, by analyzing existing data, what we call administrative data, seeks to understand what is a recommended set of interventions that are uniquely tailored to someone's needs equitably. And so keep that metaphor in mind as we walk you through this technique. Now, we've applied precision analytics in a number of growing engagements with clients across a number of growing industries. The research method is one that's rigorous and data-driven and used for over 50 years in over 100,000 or more peer-reviewed studies, and refined using artificial intelligence for more than 9 years. And you can see here on the slide that we've applied this precision analytics approach in quite a number of sectors and industries, from child welfare, where some of the early work was pioneered, in fact, with Casey Family Programs, juvenile justice with Broward County in Florida, health equity with health systems, racial economic justice with Living Cities, the intermediary. We're doing a growing amount of work with the National Science Foundation, which really taken hold with these techniques, workforce development, various areas of the U.S. Department of Health and Human Services, mental health, behavioral health, nonprofit capacity building, and the list is growing every day. So all that to say, we've had a number of use cases for this technique. We'll play out one of them for you in today's presentation. As I mentioned, there are quite a number of publications reflecting the undergirding of this work, but here are some specific publications from Pete and from myself, which you'll have opportunity to have access to these publications from the Rockefeller Foundation of Measuring Results and Impact in the Age of Big Data. The specific paper you'll have access to is there in the center left, Unlocking Real-Time Evidence for Practitioners by Project Evident, and funded by the Bill and Melinda Gates Foundation. Right of center is work we did with the Scattergood Foundation and Gemma Services, which you'll see shades of that today. Those three publications were produced by Pete, and then that last publication on the far right is the book I'll be releasing this fall, entitled Data-Driven DI, which will also highlight many of the techniques that you'll see today. So here's a high level on the precision analytics method. And as you can see, it's 3 steps that comprise our precision analytics approach. finding, accessing, and preparing relevant data sets, using machine learning to find the natural experiments that occurred in history and evaluate what worked equitably. And then lastly, produce and automate the results. I'm going to dig in to each of these 3 steps to give you more of what happens under the hood for precision analytics. So first is finding and preparing relevant data sets. And we think about precision analytics under 2 frames, cases and places. In the case, no pun intended, in the case of cases, we think about individuals, families, children, youth. And in that regard, we're looking to access administrative data sets, typically in a case management system or program delivery system or other platform that's capturing the services that are being delivered. And in the places context, we're talking about neighborhoods, census tracts, geographies, regions. And in both cases, we can both combine administrative data that our clients have already assembled within their data management systems, but we can also integrate and combine and access other data sets, government data sets. We've brought in, for example, you'll hear more about this, data from the US Census Bureau, from the IRS. We've already built workflows around those data sets, other big data sets, be they economic, social, health determinants, et cetera. And that comprises step 1. Step 2, which has a couple of steps within the step, is where we're using artificial intelligence to find what we call the naturally occurring experiments. In other words, we're looking into history of all the sets of interventions that were attempted to determine what worked for whom and what didn't work, and to do that equitably. Here are the steps that comprise step 2. First, we find what we call matched comparison groups. And in this regard, we're looking at which individuals, organizations, or communities share similar capacities, settings, situations, conditions, other characteristics that we can match them upon. But bear in mind that when we're matching, or when we're identifying these matched comparison groups, we're not matching them on factors that should not influence whether they receive an intervention. So for example, race should not factor into whether somebody receives an intervention. Gender should not factor in. So we don't match on those variables. We do something with those variables later, but we're looking for only those factors that reflect how well they should respond to the intervention, but not whether they should be chosen for the intervention. So that's the first part of step 2. Next, we asked the question, which members of this group got or did something different? For those who got or did something, or those who did not. So we're looking into the data to determine which members of the group got an intervention or did something different, so that we can now begin to distinguish between those 2. Pursuant to that, we're now asking, having looked to see who received an intervention, who did not receive an intervention, was there a significant difference in their experiences having received that intervention? And we can make a comparison between those 2. And here's where machine learning works wonderfully, because it can go into the data set and it can find all these various permutations of who received it, who didn't, looking again at only those matched comparison groups. So we're able to control for factors that allow us to compare apples to apples and not apples to oranges. And then we ask the question, having determined what works for whom, because we're going into the data to see where did the intervention lead to a certain outcome and where did it not. Now we can go back and look to see, did marginalized populations have access to positive experiences? In other words, we're evaluating the fairness of who had access to what works. The previous step determines what works for whom. This step determines, did populations receive what worked for them equitably? And then the last step, and I'll turn it over to Pete to take us even deeper, is to produce and to automate the results. And we have a number of ways in which we can automate the results. It can be automated through traditional reports. One of our favorites is to operationalize the results through a dashboard. We can actually create real-time on-demand accountability dashboards that are interactive and allow our clients to be able to manipulate the data and analyze the data in real time. And then also in the same vein, decision tools, where we're producing, as Pete said at the beginning, we're producing tools that equip and empower frontline decision makers, those who are making decisions of what to deliver to whom, not to define what they should do, but to scaffold those decisions with decision support that can hopefully improve the decisions of who's receiving what, because it's based on our understanding from the data set of what has been shown to work for them. And so we're in some ways kind of maximizing the likelihood of an outcome by scaffolding decision makers with tools to help them make better decisions. And that's both predictive tools that say, here's what are the possibilities of what you could achieve if your clients get what works for them. And also prescriptive tools that say, here's what you should deliver to them based on what we know works for their match comparison group or people who are like them. So on that, I'll pass it over to Pete, talk about the benefits of precision analytics, perhaps add or subtract to what I've shared thus far, and then continue with the presentation. Pete?
No, terrific. Very good. We've covered a lot of the big picture level. What I'm about, and when we have all these findings, as Randal was just sharing, we really see a lot of benefits. And one of the things that I think is really important is that matching process that Randal described. We just talked about the equitable element of this, which is not matching based on criteria that shouldn't be a selection criteria for whether someone experiences or receives an intervention. In addition, the evidence-based is a big component of this work. What's happening underneath all of this is something we call causal modeling. That's what's underneath precision analytics. So as Randal was describing, we are finding counterfactuals where similar people with similar backgrounds and histories, and again, not demographic necessarily, but conditions and situations and histories, they're matched. Once we understand, and then in history, as we all know, for a lot of reasons, the same types of folks with the same types of challenges are not all receiving the same experiences. In there lies natural experiments where we can do what we call counterfactual analysis. This is the key to why this is evidence-based. While it's not in traditional evaluation, and when government funds programs, they'll often say the ideal they'd like is a randomized controlled trial that a program works. When we can't do that, this is almost your next best way to get there. It's a quasi-experimental approach to really understanding outcomes through what the government calls evidence-based. The other advantages of all that Randal just laid out is that because there's a technological element to this, we can automate many of the functions, and machine learning can even advance that even further to really be able to produce these kind of insights, decision support insights and evaluation insights on demand. They're actionable because it's like having a recommender engine right at your fingertips. And it's cost effective because that automation, once you have put these models together, you can realize a lot of benefit through that technological automation. So those are the benefits. So what I'm going to do now is really quickly highlight something that I think a lot of times is a question that comes up at these points in this work, which is what is machine learning? For a lot of folks that work with this stuff, they know it and understand it, but for a lot of folks that are just getting oriented to it, it's good to understand what it is we're talking about, because machine learning is a big piece of this work. And it is because it comes with very specific benefits, which I'll talk about in a moment. But I just want to share a little brief history on kind of what machine learning is and where it fits in this whole area of artificial intelligence. AI is just something that allows computers to do things that typically require the brains of humans. There really have been developmental stages. AI, in its broadest term, is when we think of humans coding the rules in the machines. So if you think about all the games you might play online, or games like apps and other things, most of those, although they're getting more and more sophisticated, are humans coding the rules. And then what you're interacting with is a human rule-based system. It's happening automated, so that's the definition of that AI. As we start to move a little further, we've now entered into the 80s, 90s, and now it's even advancing more. We have machine learning. And this is where data scientists are training machines to discover the rules. So they're learning the rules. Machines are learning the rules, but it's still controlled by the data scientists. You might have all heard in the machine learning world of deep learning. which is machines learning the rules on their own. So think when you hear about, Google Translate or visual recognition software or self-driving cars, these are actually machines that are taking feedback in real time and learning as they go. There are many deep learning models that actually can learn from scratch. There are now programs that are going beyond what some of the first winners of chess were, that are actually learning chess from scratch, never having just all they know is the basic rules and being able to quickly become champions, if you will, and beat the champions. That is deep learning. Now, what I want to share about this, it's really important because when we're talking about precision analytics and the importance of it, it is also about really being careful not to perpetuate the biases that are also inherent to machine learning. In all data, we know that really most of data is actually the documentation of decisions made by humans, whether it's what you want to buy with a credit card swipe, or a human of a practitioner, a doctor prescribing drugs or medicines or interventions. These are decisions. Police officers deciding whether or not to arrest somebody. These are human decisions that go into databases, and machine learning algorithms can just perpetuate whatever biases those humans' decision makings are. And so we have to be very thoughtful about how we use these tools. There are certain advantages, which is the next slide, of why machine learning can be very powerful. And that is because if we think about the way we typically have analyzed data in the past, we often do statistical analyses that has to follow very specific rules. There's limitations with how we code data. We can't use all types of data, just numbers. And it has to stay pretty simple. And once it starts to get beyond a certain point, it becomes very challenging. Well, what machine learning allows us to do is we aren't limited by using numbers, where there's no need to follow rigid statistical rules. You can use categorical variable, you can natural language variable. There's all kinds of ways to process information, and therefore you can actually easily analyze complexity, and you can automate every step. But as I just noted above, the real challenge we have, and why we're intentional about our precision modeling approach, is we have to be careful because we could perpetuate biases. And if we don't do this precision modeling, this causal modeling, with the steps that Randal just laid out, we're going to really struggle to perpetuate those biases. So in fact, there's some cornerstone pieces of what we just shared about the approach that are really important. So the next thing I want to do is really quickly just summarize this and move into an example, okay? But in summary, what I want to point out is if we want to use machine learning, we have to be very thoughtful about how we're doing it. For example, at BCT, when we're applying precision modeling and all those projects you saw listed that Randal talked through, we do not use black box algorithms like deep learning and neural networks and other types of algorithms that we can't transparently see what's going on inside. There are many other machine learning tools that we can use, and we're very thoughtful about that because part of the goal of a lot of this work should be transparency, so people can see what's going on. So we don't have that classic case you might be reading about in the media now, where we know that the algorithms can't even explain how they came to the conclusion they did, okay? So if you just click, there's some animation here. On the human codes the rules into the animation, the challenge we've had is, as I just noted, and we all know, there are human biases. On the deep learning stuff, there's some element of the machines, we're perpetuating human biases if we're not careful what we're doing. But what we're very intentionally in precision modeling is doing, we're not just training machine learning algorithms. What we're doing so, we're evaluators, social scientists, and program experts train the machines. And we're doing it to discover the rules for what works, and we do it through this lens of equitability, okay? So let's talk about an example. Let's give you an example of how this works. And Randal had talked about Casey Family as one of our cornerstone projects that we've been working with for years. They provide foster care services in 5 states in the United States. So they are engaged by states to help support and run their foster care programs. They have an administrative data set that crosses over all 5 of those states. And we ran a precision modeling process as Randal laid out the overarching steps. So the first thing we talked about was finding match comparison groups. So what you're seeing here is actually machine learning algorithms that discover groups of foster care kids who respond differently to the program based on their background. So, and again, without matching based on things like race or gender, if that should not be a selection criteria. In this case, it shouldn't. What you see here in all these percentages are certain groups. So to give you an example, older kids with a whole lot of placements, they've been bouncing in and out, they really don't have any what's called permanency resources, family, friends, people to take them and adopt them, okay? Those cases have only a 15% engagement level, okay? But and this kind of will make common sense, right? If you move to the right, you're gonna see some cases like those that are placed already with families that are willing to move forward with the process of adoption or bring those families back into their original parents and families, which is the ideal goal. They might have a lot of different assets, strengths. The kids have a lot of things they're working with. They're doing well in school. Those kids are responding very differently. So the point here is we don't want to compare all these kids. If we were just to evaluate this and look at the model, regardless of who these were, just kind of put them all together in one group, we wouldn't be able to really appreciate, like precision medicine, that each one of these groups has very specific needs if we're going to succeed. So the first thing we have to do is find these groups and really understand what makes them different. We're going to follow in this example the third group, the 50% group, the one that has the icon of the girl with the luggage. These are 14 and younger kids who've had 6 or more placements, and just know they also do not have a lot of what we call permanency resources in their lives. So we train the algorithms then, and we did this. This is a real example. The goal that this organization, the program is serving, is to try to achieve legal permanency. That's adoption or return back to the original home. For these kids, they're really struggling with a lot of bouncing in and out. They don't have a lot of places to go. So what is it that makes a difference? Well, if you look here, the algorithms were able, machine learning algorithms could pick up on a pattern of 3 program elements: permanent relationship building, which is a program, coping and conflict resolution, which is a program element, and runaway prevention plans, another program element. When those 3 things were combined, you can see that when these kids got these 3 things, they were 55% likely to achieve legal permanency. Not 100%, but still 11 times more likely than those that did not. I will note for you, if you really look at this, that still is obviously not a perfect success rate, but if you see the comparison, it's key that those best practices of those 3 what works are the things that make a difference. So that can be discovered and was discovered. The next step. So the next thing it does, those are those natural experiments, right? And in here you can actually see, if you think about that group, there are actually 4 outcomes. There was the 55% success, meaning they got what was needed, they succeeded. That's our service success. But we also know, and this is where a lot of learning can happen, we also know the cases that did get what was needed, but still that 45% that didn't succeed, we know those are unknown needs. And the way that's helping practitioners and others on the front lines is we know who those cases are, and we can investigate maybe what are the things in their lives that we're not measuring that could be explaining why they aren't, what additional needs they have. On the other side, we have those cases that didn't get what was needed, but somehow succeeded. These are the odds beaters. We can also go study them and find out what they might be doing that we don't have measures for that could be really make a big difference, because that's valuable information. But we also know who didn't get what was needed and didn't succeed. And that's our attributable failures, the unmet needs. If we get them over to the other side, give them what was needed, which is those 3 factors we talked about, we know we're going to be successful to the 55% level. So that's an example of how this is really driving insights and ongoing learning for practitioners. Next slide. This is just a breakdown of it, and you can imagine this is an evaluative breakdown where you can see, well, how effective are we with this group? 60% get what works, 40% do not, and we can see the breakdowns of these. Okay, next slide. So then what we talked about before and what Randal introduced was the idea that we also don't put in factors that shouldn't be selection criteria. But what we do is, for this group, is after we know what works, those 3 things that are listed there for what works, we can evaluate, is there a statistically significant difference based on race, for example, for who gets what works? And for this group of kids, we can see, in fact, there is. You can see that there is that white children in this group are more likely to get what works, 65% compared to kids of color. And so that's an insight that we can share back with the organization that then allows them to investigate that further and address some of the DEI issues, which again, I'll reference back to Randal's upcoming book, which is going to speak to a lot of these issues and how this is about data-driven DEI. This is a good example of how we're really beginning to advance and how we use data to drive DEI, and even address sometimes the concern, and a good concern, that machine learning and other things could actually make things worse from a DEI standpoint. But what we're showing you here is a way to actually counteract that, evaluate it, and actually highlight those areas where there are inequities within the system, a program, or a service. Okay, next slide. This last slide is an evaluation slide. It helps everybody who's running a program, in this case foster care, look at each of these groups of kids and say, okay, so how are we doing? Well, for this group of girls with the suitcase, 34% are getting what they need, what works, and succeeding. The gap between 34% and 55%, if you remember that 55% number, that's the performance gap. With what we know, we could be able to get that 34% to 55%. But that 55 to 100%, that's the gap that we don't know. For this group of kids, what's abundantly clear is we don't have measures or deep enough understanding of what works to get them to 100% success. We can get them more successful, but we can't get to 100%. Whereas there are other groups, almost 5 other groups, that we actually do know what to do. And it's just a performance gap that we need to close. Okay, but this dashboard also gets automated. And this is that evidence generation. This is the piece that a lot of governments and others are very interested in, because it can generate, and all of this is being automated every day as the data comes in, because I want to emphasize it is sitting on top of administrative data. So what that means is it's actually not requiring new tools. Okay, all of this assessment and transactional data is already in the system. We're just building, it's like the Intel inside, right? We're just building the brains on top of that system to produce this. So the data goes in, it gets scored, the reports come out, and we've even got dashboards and examples of this that are live right now that practitioners see on a regular basis, so they can update, monitor, plan, evaluate, and even learn together to see what's going on with the kids that they're serving. So I want to give you, that was a cases perspective. And remember, Randal was talking about cases and places. On the places side, we also did a project where we brought together government data, 2 types of government data: American Community Survey data conducted by the Census Bureau, which gets down to the census tract, which is community, over 73,000 in the US. All kinds of indicators on that, because it's done annually. It's not the decennial census. This is an annual survey, intentional sample, very rigorous, of over 3.5 million people throughout the country. Okay, we wanted to examine with these data, and they also combined it with the IRS 990 data, so we know how much government funding, philanthropic funding, we know how much programmatic output by type of program, youth development, mental health as an example, and we have geospatial algorithms that know how much of that is accessible, so we know where that accessibility of those services are through geolocation and mapping all of this out throughout the United States. So here's an example of precision analytics where we're trying to answer this question. Does access to mental health services for a community, meaning drivable access, it's also socioeconomically accessible, if you will, does that over time improve community well-being? The ACS data has a reliable, valid, well-reviewed, peer-reviewed publicly measure called the Area Deprivation Index. It's highly correlated with health index, with health and well-being of individuals. And we're asking the question, does access to mental health services make a difference on well-being? And so here's, you can see, we find an access to relevant data. The next slide. So remember, this is a places example that's similar to the cases example we just showed with Casey family. We have machine learning algorithms find match comparison in a group of communities. So for example, we would find, if you click the button once, there were urban working poor census tracts that have good access to public transportation. Because this type of community was different from other types, they were found to be a group together. Then for these types of communities specifically within that match comparison groups, we could find those, and you see the red dots where they didn't have access to mental health services. This is a counterfactual, it's an experiment. Well, we have a counterfactual here. What do the red communities with no access, how do they compare on area deprivation index or well-being on a scale of 1 to 100, where 100 is well-being, compared to the same types of communities that did have access to mental health services. Next click, I think. There you go. So then we could evaluate. So if you click one more, so what was the difference in the United States? We looked at the whole US, and for these types of communities, and we looked at all communities throughout the US, we could see that mental health services, access to mental health services, was a very big predictor of community well-being. And we controlled for their rural, urban, suburban population, their access to transportation, their socioeconomic status, and how much funding was going to those communities. We controlled for all of that. And we could see that, in fact, mental health services really make a big difference, which, by the way, just saw that the federal government is making one of its top 10 areas where a lot of the government funding is going is for mental health services. So that's a good thing. Next slide. We can also evaluate fairness. So if we take a look at that same group of communities, we can ask the question, right? Is this fair? So if we look at communities where they're more white compared to their county proportions, compared to the communities that are actually more persons of color in those communities, we shouldn't see a statistically significant difference on access to mental health services. But in fact, in the United States, if you click the button, we do. Okay. So you can see it is, just to draw attention to this number, a difference between 20 and 30% essentially is a 50% difference. So put another way, communities that are more white are 50% more likely to access mental health services, even when you match them on all those criteria. So there's an inequity there that can be identified from this kind of analysis. So again, precision analytics to identify those. And here's an example, and we see for almost all types of services, okay, we can see that there really is an access issue. Mental health, number one, but for all types of services in the nonprofit sector, we can see that it does affect community well-being. If you have access, drivable access, socioeconomically accessible. Next slide. On the next slide, you'll see that in here, it actually shows that for most services, there is not equitable access to these services based on the diversity of the community. Communities with more people of color are less likely to have equal access, if you will, equitable access to these services. Okay, so those are some good examples. So Rand, I'm going to pass it back, and I don't know what our time is like, but happy to also show a little bit of what these kind of tools look like in the real world. But what do you think?
Yeah, let's do a quick show of the tools. And while you're getting that pulled up, I'll say that what you all saw were slides that walk you through the methodology and the approach. But as we've mentioned many times, we have live applications and tools that bring this real time to our clients and to our partners. And Pete will show you just a few of those tools so you can get a live look at live data.
So what I'm showing you right now is a mental health tool built on children's residential psychiatric care. The average stay for kids in this mental health facility, residential facility called Gemma Services, the average stay is a year. So these are kids with serious mental health issues. They are in residential setting. 40% of these children are actually also involved in the child welfare system. Okay. This is an organization that had us model their administrative data, their electronic medical record data. And we were able to take that data and apply precision analytics. And what you see here is an example. This is their beta version with identities hidden with fake names, but it's a real live tool that shows you exactly the functionality that we were describing. So precision analytics allows us to really, from a research standpoint, evaluation standpoint, learn in a more causal way, quasi-experimental way, what works and be able to generate recommendations. We can take it to a whole new level, which is applied tools for practitioners on the front lines. Again, you can read more about this in the case study. This is one of the examples in the Gates Foundation publication case study. So if you look at this to start with, if I'm a practitioner, I can go to an individual report on anyone that I'm serving. So let's say we take Tabitha Flint, okay? I can track. We know that if we don't get Tabitha's acuity down to a 1.5, they are 2 to 3 times more likely to return to hospitalization within a 6-month window of being after they exit. And that's what we're trying to prevent. What you can see here is that counterfactual proof. We know that there's certain goals and objectives that we are tracking through assessment tools. And we can actually see, if you look at this, we can actually sort for Tabitha, what are the most important things to work on? Well, we can see that most important, and you can see when we successfully address behavior needs, peer relationship problems, or thoughts of hostility, you can see the differences between the success rates when they exit versus the success rates when they don't. And this is a point in time. All that administrative data is being calculated all the time and modeled all the time and scored. And then it feeds back to the clinician, in this case, maybe a psychiatrist, it may be a counselor, and it says, hey, listen, we already know that there's a lot of areas of red for Tabitha that need to be addressed. And if we don't address some of these top areas, we're not going to see success the way we would like to. And we know with kids like Tabitha, which are at intake, they have PTSD. They don't have a lot of PTSD. They just have multiple diagnoses. So we know who the group they are, and that's that block MASH group. So if you're a practitioner, you can begin to focus on these areas in terms of interventions and how to do it. And you can monitor this over time. If you're Gemma Services and you're a funder, or you're on their board, or you're an executive at the organization, or you're a program leader or manager, and you want to understand how are we doing, there's an evaluation dashboard like the one I showed you in the deck. And this one actually shows you those, remember those 4 areas: attributable success, independent success, is we got what was needed. We didn't get what was needed, but we succeeded anyway. Unknown needs, and these are all the different groups. Sorry for the small font, but this gives everybody real time, and they can look at their current and active and discharge. All of this is very dynamic and allows everybody the information. And again, it's on demand, live, and there's causal modeling that underlies this. So we're reducing and removing a lot of bias in order to really get these insights. On the places piece, quickly show you how we're doing this with the places piece. So that modeling we showed you with the mental health access to services, we can actually then deploy that in a different way. We can actually pull this up in a community. We can actually identify, we can go to Allegheny County, for example. We could focus on Pittsburgh, okay? We can actually find the city like Pittsburgh. We can actually look at Pittsburgh and identify, try to find where are the vulnerable communities, okay? And we can even focus, if we want to, on different types of diversity. And let's say we know that there's a lot of vulnerable communities that are being disadvantaged and left out. They're not included, if you will, in the community in Pittsburgh. And we want to focus on more people of color. We can highlight those communities. And if I hover over any one of these, I can actually show you what that community is, how they're doing. You want a score of 100. Community well-being is 15 is not good. That's weak. That's very fragile or in decline, actually. We can see that while they have high drivability to mental health services, that's the access, their community giving, they actually have government and donations and volunteers and others. There's a lot providing supports for mental health. But here's the key. For this community, there's not enough program output. So there's probably only a few small organizations that service that community, and their need is much bigger than the amount of programming they have. So while they can get to mental health services and there's funding for it, it's not enough, meaning there isn't enough programming. So think of it as like, if it's a $100,000 program, that community needs $500,000 in mental health services. So there's a gap, and we know that through the causal modeling. The really interesting thing about this as a use case is you can now go and see these same communities. You can actually find the nonprofit mental health service providers that service these communities. So you can see particular community, you can look at the organizations, and you can even see how well they're doing. And you can see part of the problem why they don't have enough access is they're very small organizations. There's only one organization here that's even 4 million. So that's got to be, even that's a small organization. So there's not enough. We can look at the financial health. We can actually understand what's going on with those organizations, see their finances. A lot more to share here. But the point is that these kind of tools can help us pinpoint communities where there are needs and inequities, find the organizations that support those communities and support those organizations. And maybe even think about how you could work with those organizations to be able to provide more programming, especially because we just established that these are the communities that need it the most. And again, precision analytics undergirds this. So I'll pass it back to you, Randal, but those are just a couple examples of actual live tools that are sitting on precision algorithms that are built on administrative or on place data.
Excellent, excellent. Thank you, Pete. And that essentially concludes this portion of our engagement with all of you. You have our contact information listed here on the screen. You can reach me at rpinkett@bctpartners.com or at randalpinkett.com with one L. You can reach Pete at pyork@bctpartners.com, and you can learn more about our organization and the work that we're doing at BCT Partners at www.bctpartners.com. Our mission at BCT is to provide insights about diverse people that lead to equity. And certainly, hopefully, you can appreciate the relevance of that to the work we've shared today around precision analytics. So I want to thank my colleague Pete. Thank all of you for taking time to dine with us virtually, so to speak. And we look forward to engaging you live through the questions and answers. Thank you very much.
Thank you.
Thank you both for joining us. I know our participants are looking forward to live Q&A with you during the Institute in June. See everyone soon. Thank you all for watching. For more information on SICSS-Howard Mathematica, visit our website, follow us on social media, and join our email list.